Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about occipital nerve blocks. Well, what is it? It's an injection of numbing medicine next to the occipital nerves, which are located on either side of the scalp, originating at the neck. There is a greater and lesser occipital nerve. Either one of those can produce pain, but neither has a motor function. They're only sensory, okay? The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, or migraines. The injections have both a diagnostic and a therapeutic purpose. The symptoms of occipital neuralgia may include pain in one or both sides of the head, a tenderness to the scalp, along with an aching or a burning or a throbbing pain. It may be described as either a sharp or electrical shock in the back part of the head and neck. Well, who benefits from an occipital nerve block? Those with occipital neuralgia, migraine sufferers, cervicogenic headaches by definition, or any headache that's caused from the neck, and that's usually one-sided, and then cluster headaches, which are one of the most painful headache types. How is the procedure performed? This is a quick procedure. It can be done in the office in just a few minutes. There's no need for sedation. What the pain doctor will do is feel the point of maximal tenderness at the base of the skull, and that's the point of injection. The doctor will then move the needle in and sort of in a fan type of technique to inject both nerve areas, the greater and lesser occipital nerve, with numbing medicine and possibly some steroid. For such a quick, low-risk procedure, occipital blocks work amazingly well. They provide pain relief within a few minutes most of the time. For cervicogenic headaches, there's a 50 to 90% response rate, which averages a few months. Cluster headaches, there's an 85% response rate, averaging anywhere from 4 weeks to 4 months. For occipital neuralgia, there's an 85% response rate for 1 to 2 months. And migraines, a 60% response rate, averaging about a month. These can easily be repeated in the office as necessary. When the pain relief wears off, what's next? You can have a repeat procedure, or a pain doctor can do pretty much the same type of procedure but do a radiofrequency ablation, okay, where it heats up the occipital nerves and sort of deadens them. Okay? Remember, these are sensory nerves. They're not motor, so you're not going to be hurting any of the function of your head and neck. There's a very small set of risks with an occipital block. There's a slight risk of bleeding, infection, or an allergic reaction. The needle is well outside the spinal canal, and these are not motor nerves, so there's no risk of a cerebrospinal fluid leak or a spinal cord or nerve root injury. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state providing over 25 different treatment options and accepting over 50 insurances with the board-certified doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.